In today's video, I'm going to give you a lot more information about the most dangerous causes of the swelling in your body, especially in the lower legs and lower extremities. Did you know that 55 to 60% of your body weight is water? Water flows through your body from one area to another. It is present inside and outside your cells and keeps your thighs moist. Your bones, joints, spinal cord and the brain also need water. But sometimes too much water can build up in your tissues, leading to swelling in your arms and the legs. This is called peripheral edema. It is caused by several factors that is very severity. For some people, peripheral edema is only temporary and will go away on its own. But for others, it is a serious problem that causes by serious, sometimes life-threatening situation and medical condition. Fluid buildup edema. This happens when the tissues or blood vessels in the legs hold more fluid than you should. This can happen if you simply spend a long day on your feet or sit for too long, but this also be sign that you are overweight or not getting enough exercise or more serious medical conditions. In today's modern world, a lot of you suffering from this edema, and you cannot find relief because you never get to the causes why you have so much edema in your body. My first very important information is going to be inflammation. This happens when the tissues in the leg become irritated and swollen. This happens natural response if you break a bone or tear a tendon or ligament, but it can also be a sign of more serious inflammatory diseases such as arthritis. Second, congestive heart failure. This happens when your heart is too weak to pump all the blood to your blood needs. This leads to fluid accumulation, especially in the legs. Other symptoms of congestive heart failure: shortness of breath and breathing difficulties, fatigue, cough. Third, vein problems, deep vein thrombosis and thrombophlebitis. If you have those kind of conditions, it means that is blood clot in your vein in your leg. It could break off and travel to your lungs. When this happens, it is called a pulmonary embolism and can be a life-threatening situation. One of the first symptoms of these conditions is swollen legs, especially cough, and the blood pools in that area. Check with your doctor right away if you have swelling in one leg or any other of those symptoms, leg pain, tenderness or cramps. Skin is colored red or blue, skin that feel warm. In this modern era, the drugs are sold with many medications that is very bad for our body, especially if you take medications on the long term, maybe months, maybe years, that it can also cause the swelling in your body. Also, this modern era nutrition is unbelievably unhealthy and contains many thousands of unhealthy chemicals that we eat each day. And that's why many of those chronic deficiencies in minerals and vitamins can cause that you have the leg or any kind of swelling in your body. Also, you can have kidney problems. Long-term kidney disease happens when your kidneys don't work as well as they should. Instead of filtering water and waste material from your blood, fluid collects in your body, causing your arms and legs to swell. Acute kidney failure. When your kidneys suddenly stop working, can also cause swollen legs, ankles and the feet. But this usually happens when you are hospitalized with other problems. Medicines. Sometimes swelling can be unwanted side effects of prescription drugs. Medicine most likely to cause swollen legs include heart medications called calcium channel blockers are often to blame. Also non-steroidal anti-inflammatory drugs and NSAIDs such as aspirin, ibuprofen, certain diabetic medications including metformin, Hormonal drugs contain estrogen or progesterone, some antidepressant. That is also very important. One of the most serious conditions that you can have that causes the legs for you to swell on any kind of swell in your body is going to be joint problems, especially if you have something called arthritis or osteoarthritis. That means your joints have problem, have inflammation, and that can cause inflammation. If you have I don't know, like knee problems, hip problems, maybe swollen arms, that you have rheumatoid arthritis or similar kind of condition, that is very serious conditions that can cause that you have the swelling. Also, lung condition. If pressure in the lungs and heart gets very high, which can happen when your body is reacting to certain medications, this can cause the legs and the feet to swell. This can happen as a result of serious lung conditions like emphysema or pulmonary fibrosis. Or it can occur if you have a congestive heart failure or your heart isn't strong enough to pump the blood that's returning from your legs. Since the heart, lung, kidneys and the brain all work together to regulate fluid levels in the body, when one organ is forced to work harder as a result of medical conditions, hormones are often released to either retain or provide more fluids. Fluid buildup in the lungs called pulmonary edema. This means water collects in the air sacs in the lungs. Pulmonary edema can be very difficult for you to breathe. And my last warning is going to be your liver problem. In today's modern world, a lot of you have already liver problem. If you have any kind of liver disease, maybe fatty liver, cirrhosis, or God forbid, anything worse that can cause edema in your body. And those are the main conditions that you need to worry about it. As always, take care of yourself, live healthy, eat healthy, take natural remedies, and those problems are not be anymore.